Hi, welcome back to East Meets West, an integrative approach to men's health. I am one of your hosts, Dr. May. I'm a naturopathic endocrinologist practicing for 15 years now, and my main focus now is on endocrine disorders, mostly like low testosterone in men, which is what we're going to get into some today, as well as perimenopause, menopause women, cycle changes in women, and hypothyroidism. Mike, introduce yourself, buddy.
Yeah, my name is Michael Johnson. I've also been practicing for 15 years all over the country, and I work a lot with men's health, with pregnancy and fertility, allergies, and Ash and I just have a blast doing this show, so I'm excited about today and hearing what he has to say.
Yeah, absolutely. So we're going to get into some fun stuff. So recently, I just gave this talk at a endocrinology conference, and just to kind of the last several weeks, I've been doing the research on this, basically on how is the environment affecting our testosterone levels and erectile dysfunction and infertility levels in men. Um, and the evidence is pretty shocking, which we'll go through today. And I'll give you some specific things that you can start doing to try to alleviate some of that stress on your system. Yeah. So, Mike, anything you want to like jump into before we just kind of get into andropause and low T and erectile dysfunction, infertility, all that kind of fun stuff?
Now, I'm excited about this, and you can already guess the main organ that's going to be dealing with all this, I'm sure. So
I'm going to put my money on kidney, but
you are
we'll
correct.
see. I'm learning. It's taking a
You,
while, but I'm learning.
you are.
Yeah.
3.5 years of training, so I can say kidney over and over again.
That's right. I hear you. All right, so let's dive in. So first, let's kind of talk through some terms and prevalence, incidence, kind of the numbers, which is what I love to kind of dive into. So let's just talk about terminology first. So oftentimes you'll hear the term like low testosterone or low T or andropause. It's like, what does that even mean? Well, it can mean actually different things to different people, organizations, and different places around the world. For all intents and purposes today, we're going to say low T is basically at 300 or below of total testosterone. Andropause is kind of the process of your testosterone levels slowly declining with age. Now, typically, we see a very slow, precipitous decline in age, starting around 30 to 35. It's somewhere around like a 1% drop per year has been pretty normal over the last several decades. But what we're seeing more recently in the last 10 to 20 years is a much more precipitous drop in those numbers. So obviously, you have to ask the question, why is that occurring? And that's what we're going to get into some of those potential causes today, and mostly related to things in your environment. So just to kind of talk real briefly about prevalence and incidence, like how significant is andropause or this lowering testosterone levels in our society? So there was a 2007 study done on a 50-year-old man in the 1980s had a higher level of testosterone relative to when this study was published. So basically they were 38% higher back in the 80s than they were when this study was published.
Wow, that's a huge difference.
Yeah, almost 40% difference just in like less than 3 decades. Also, the Baltimore longitudinal study of aging showed a incidence of low testosterone, which they classified as less than 325, to 20% of men in their 60s, 30% in their 70s, and 50% in their 80s. So again, we can kind of see that increase in incidence as men get older. Now, there was another study called the Massachusetts Male Aging Study, and it reported a 22% drop in total testosterone, 45% drop in bioavailable testosterone, which we'll talk about in a second, just from the 1980s to the 2000s. That's across all men of all ages. So that's pretty significant.
Yeah, that's
And
pretty
then,
crazy, man. I would not have expected that.
yeah. And then 12.3% of men aged 40 to 70 had a total serum testosterone levels of less than 200 plus 3 different or more symptoms of low testosterone. Under 200 is very, very significant. So having 12.3% of all those men having levels lower than 200, that's pretty significant. And then you can kind of see a chart here. It's just kind of nice to see. You can see the first ones, the blue and the red, are the 1980s. Then you got the 90s. Then you got the 2000s. So if you just look at the blue, you can see this drop of total testosterone through those decades. Now, these are the same age men. They're just in different decades. Right? And then you look at bioavailable testosterone. Think of this as kind of more like active testosterone. It's not the same thing as your free, but it is the testosterone that's weakly bound to a protein called albumin, which is easy for your body to kind of dislodge and take off. So it's testosterone that is sort of readily available to be used. And again, we're seeing a pretty significant drop there. All right. Any questions there, Mike, so far?
No, it makes sense. I'm glad you mentioned the total numbers because a lot of listeners may or may not know this, but different doctors have different thresholds, and a lot of times it can be based off of insurance recommendations as opposed to what is good for the person. So I've seen in my practice that people will be low, but they won't be considered low because the insurance won't pay for treatment. So
Yeah, I've got a slide on that. Let me see if I can find it real quick because this is pretty astonishing. Yep, here we go. So diagnosing sort of low T can be vastly different depending on where you're at. So if we look at here at the American Association of Clinical Endocrinologists, their cutoff number is 200. Okay. You've got the Endocrine Society at 264, the American Urological Association at 300, which is mostly what we use. Most providers in America use this number. And this is still what's considered for most insurances to be the standard for a diagnosis of low T, of having 2 different blood draws that show a level less than 300. But if you go below that, look at all these European or sort of other associations or societies outside the US. You've got the British Society of Sexual Medicine at 345, the European Association of Urology at 345, the International Society of Sexual Medicine at 350, and the International Society of the Study of Aging Male at 350. And that's the level that I agree most with. And I really like this organization, this International Society for the Study of Aging Male. They're really producing some really interesting information and data. And I think they've got a better handle on really what low T is, andropause, that sort of thing. So I would, like I said, agree with the 350 number.
Yeah, it's interesting.
All right, this is another one too, just to kind of show chart-wise. This is a more recent study that was based out of Israel. You can see the darker colors are earlier, so early to mid 2000s, and then 2010 to 2012, 15, and then 16 to 19. But what you can see here is, again, a lower drop based on time, and it's pretty consistent across the board there. So again, as we're moving forward in time, we're seeing men's testosterone levels in general going lower and lower and lower. All right. So some risk factors for andropause. So things that can cause low testosterone in men can be any form of chronic illness like diabetes, some lung conditions, inflammatory conditions, obesity, metabolic syndrome, sleep apnea, and a genetic condition called hemochromatosis, which is an iron overload condition. And we just some specific numbers here. 20 to 64% of obese men have low T, and 33 to 50% of type 2 diabetics have low T as well. So there's definitely a distinct correlation there between those conditions and low testosterone. And then the prevalence of low T in men with heart disease, the coronary artery disease, is twice that observed from the regular population.
Oh, wow.
Yeah. And then some environmental toxins that can cause low testosterone. I put a list here. We're going to go into a lot more of these later with this presentation. So,
And it
That's
actually
all.
makes a lot of sense what you're saying from a Chinese medicine point of view, because a lot of those illnesses will affect the kidney, specifically kidney jing, which is kind of
Exactly.
the essence, which has to do with testosterone, sex hormones. And whenever
Hmm.
you're affecting that over a period of time, along with environment, then it's going to burn up faster and you're going to have less testosterone. So it makes sense.
Yeah, it's totally that's a great way to put it, and that's exactly what's happening here. So I did a little did you know, just I did this presentation to other physicians, so it's a little bit more in depth than what we're gonna go in today, but this was an interesting kind of fact, that the level of oxygen pressure inside the testes is low due to this weakness of the testicular artery. Therefore, there's a severe cell competition for oxygen. So those cells in your testicles are fighting for oxygen because there's a really low amount of pressure for oxygen inside the testicles. Just means they're going to be a lot more sensitive to environmental stressors than other tissues will. So they're not going to be very resilient to those kind of stressors. And we'll get into like what some of those stressors are. All right. So the biggest issue when we talk about environmental toxicants is this thing called oxidative stress. Now, think about some iron and when there's moisture there, you get oxidation, right? So you get rust, and that's that process of oxidative stress. So basically, it's just causing that thing to degenerate at a faster rate. And that process can happen inside your cells. And that's what we continue to kind of call oxidative stress inside the cells. These are going to be caused by free radicals. Now, you've probably heard that term used before, and the term antioxidants. So, antioxidants are things that we can take that can quelch that oxidative stress. So, they can kind of calm down that stress from oxidation. Um, and so you can see here, lipid peroxidation is kind of part of that. It's just kind of where the cell membrane is being damaged from this oxidative stress. And it can even damage the DNA inside your cells as well. All of this, especially if it's going on in your testicles, is going to cause a reduction in testosterone production. If it affects certain cells called Leydig cells, which produce testosterone, and it's going to affect sperm production, which are different cells called your Sertoli cells. Um, and obviously, that's going to affect fertility as well.
Yeah. So rust in the testicle is definitely bad.
Rust in the testicles, it's a bad thing.
It's a bad thing.
Yeah.
It's the takeaway.
Let's see. I won't go into too much depth here, but this is a great chart here. So these are some of kind of the mechanisms that can occur. Now, don't get too caught up in all these, like the pituitary and hypothalamus, but basically, these are two glands found in your brain. And what this ROS, this is reactive oxygen species, just it's another name for those free radicals. What they can do is they can block your brain's ability to produce hormones that signal to your testicles to make testosterone and sperm. They can also increase or stimulate the pathway that increases cortisol and all those stress hormones from your adrenal glands, which also inhibit your ability to make testosterone. So you're getting hit here a couple of different ways. One, by inhibiting production, and two, by increasing stress in your body, which also inhibits production. Is that making sense?
Yeah.
Yeah. Cool. So this is a really common sort of mechanism that each one of these toxins that we're going to talk about will take on. So let's talk about pesticides. So pesticides are going to be found in a lot of our food because most of the crops that we have they're using pesticides to try to improve production rates. But these residues of the pesticides do still make it into our food system. They make it into our groundwater system as well. So we're drinking some of these, small amounts of this. And we just don't really understand yet the full impact of pesticides on our environment and how much volume are we actually taking in on a regular basis. But you can see here, these pesticides do a few things. It increases that lipid peroxidation. It impairs the Leydig cells, which are the cells that produce testosterone. It inhibits your brain's ability to produce those signals to make more testosterone in sperm. This is just a look at that Leydig cell, which is the type of cell that produces testosterone. You can see this ROS is that free radical, and you can see it can damage a lot of different aspects that have to do with your body's ability to produce that end product there of testosterone here.
I have a question before you move
Yeah.
on. Oh, you're still on pesticides, but we'll probably get to it. But I'm curious if organic versus non-organic matters when it comes to pesticides.
Yeah, I mean, the idea is you assume that there's going to be far less pesticides in the organic. It's not, I mean, it generally is true because, especially if you're going to be labeled USDA organic, then that is tested to make sure that you don't have pesticides. But it doesn't mean that if a farm does it isn't USDA certified, that they don't have good stuff. It's that process is very expensive. You have to pay the government for it. So, some small farms just can't do it. So what I would encourage people to do is talk to your local farms, and they know what they're putting on their crops. And so if you can get someone to tell you, their processes of growing their crops, then you get a better sense of what your exposure might be. And also the vicinity to other farms that do use these pesticides because they're sprayed on. And sometimes that gets taken by the wind into adjacent crops and farms, which can expose those other farms to these pesticides too. Or if it seeps into the groundwater, then people locally close by who have wells, they're likely getting some of those pesticides as well.
Interesting. Yeah.
Yeah.
I think that's one thing that actually ruined my grandpa's spring is that he used a ton of pesticides all around, and the spring ended up being almost unusable by the
Mm,
end. It was awful. And because it just kept going in and he would just spray it because, he was in that old generation of like, well, pesticides get rid of pests. Going to use it as
right.
much as we can. So,
Well, for the longest, it was just about production, right? So if
yeah.
there's a way that we could increase the yield of your crop, then you're going to get paid more for that crop, right? And so why not? Why would farmers not do that, right? But then we didn't quite fully understand the health ramifications of these pesticides, and now we've got a better handle on that. And I think that the farmers are starting to use other strategies to increase yield as well. And so I don't know, it's still an upward battle here. So
Mhm.
as the consumer, we really have to do our due diligence here to try to make sure you know what you're eating, what the foods where they're coming from, and don't just assume like these companies have your best interest at hand. So this study just looks at the effect of pesticides on various hormones. LH and FSH are the two hormones that your brain produces to stimulate your testicles to make testosterone and sperm. So you can see here, based on the control on the left, and then you've got you got the farmers here, the workers, and the greenhouse workers here. But you can see those levels for LH are lower. LH is what stimulates your testicles to make testosterone. So you can see the connection there between lower LH levels here, down here, and you see lower testosterone levels as well. TSH and T4, this has to do with your thyroid. And we definitely see some correlation there of slower thyroid function based on these pesticides. And then E2 is estrogen. And here's the interesting thing. You can see estrogen levels are higher compared to the control group. So what we're seeing here, farmers in this study that were exposed to pesticides for 2 to 11 years ended up showing lower testosterone levels and higher estrogen levels, which is, especially in guys, not a good thing.
And for those of you who can't see the chart, it's a significant increase, like
Yeah.
significant.
Yeah. Yeah. All right, here's just another chart on different pesticides, how they can affect the testicles. And so don't get too caught up in this. Again, this presentation was to a bunch of physicians, so this kind of makes a little bit more sense. But really, the biggest issue is further down here where you see the decreased arrow here for testosterone, just showing all of this stuff upstream here can cause a decrease in testosterone. All right, heavy metals. Any questions about pesticides, Mike?
No, I will say that from my perspective, it also makes sense because part of Chinese medicine is that we are, one with the environment. So whatever we're exposed to, whatever is around us is going to be this, it's going to have this cascading effect on health. So it makes complete sense.
Yeah. Yeah. All right, heavy metals. So these are things like your lead, mercury, cadmium, stuff like that. Again, this is going to generate high levels of reactive oxygen species, which are those free radicals, which is going to increase lipid peroxidation, degeneration of seminiferous tubules, which are inside the testicles. You get testicular hemorrhage, which is not ever a good thing, or necrosis. So basically, that tissue is just breaking down. Abnormalities in the cells, fibrosis, which is scar tissue, and then reduced testicular size. And that's something we've seen consistently over the last few decades is actually like penis size, testicular size, testosterone levels, like all those things have been slowly diminishing over time. Now, I don't know who the person is that's going around measuring every guy's penis and testicular size. I don't think I'd want that job, but apparently there's some pretty good literature out there on it. All right, let's.
That's not a job I want.
No. All right. And then air pollution. So this is something we're both familiar with, living in Fairbanks for years. Is the PM 2.5. Do you ever watch the PM 2.5 monitors to see what their levels were in Fairbanks?
Oh yeah, and sometimes it would be like Beijing bad, like very bad.
Yeah, like some of the worst air pollution quality in the world at times. Yeah.
Yeah, that cold air pushing it down was bad news.
Yeah, we got the inversion, which just sucks everything in. But we can see here too with air pollution that it downregulates these hormones that are produced by your brain to make testosterone. That LH and FSH levels, it's decreasing those, which ultimately is going to lower your testosterone levels and sperm production. It also generates that ROS, those free radicals as well, which can directly damage the cells of the testicles too. So again, we're seeing these common themes again, where it's damaging the part of the brain, which sends the signals to make testosterone and sperm. And it also directly damages the cells inside the testicles that make those things as well. And you can see here, this is a little complicated, but you've got both heavy metals here, especially cadmium and lead are the examples used, as well as the PM 2.5. And you can just see all the downstream stuff here. But again, it's all about increased free radical damage and then what that does locally and then to the brain as well. Pretty crazy stuff.
And when we're talking heavy metal, we're not talking Megadeth, even though that could probably affect things. But sorry, I had to go with the joke.
Good point, Mike. Good point. We're not going to play any of your favorite music yet either. Okay. All right. So we do have other endocrine disrupting chemicals. Endocrine disrupting meaning hormone disrupting chemicals. Some of these are BPA. You guys might be familiar with this. BPA was big in the use of water bottles, and then they came out saying that, oh, this stuff it's not good for you, so we're going to use other basically like plasticizers and things to make these water bottles. Just kind of FYI, those still aren't very good, so just stay away from any plastic water bottles. They're just using different types of chemicals other than BPA that are just right now okay to use, but we're going to eventually see that they're not good either. So just use like your stainless steel, glass bottles, stuff like that instead.
That's a good point because, and a lot of people don't realize, but even with, from what I've read, even with like sparkling water, which I have an addiction to, it's in an aluminum can, except there's a plastic lining on the inside of the can. So when you're drinking 10 cans a day and you're like, I'm fine, it's aluminum, you're actually, it's in plastic still. You just can't see it.
Yeah, it's very true. I'm just as guilty as anybody. I love fizzy water, man.
Me too.
But anyway, BPA, this is found in the linings of canned foods. So you're right, like the sparkling waters, but also in like vegetable, cans. Like tomatoes are like the worst. Like never buy canned tomatoes because they're acidic and they're in this plastic lined can. And so that's because, especially they're acidic, they're really going to leach out those plastics into the food. Um, any food storage containers, like I said, water bottles. So never heat your food up in plastic containers, even if it's hard Tupperware. That's just a no no. Dental sealants. So if you're getting some dental work and you're getting sort of composites, put in, check with your dentist and actually get a good idea of what's being put into those, because again, you're putting these in your mouth and then you're drinking hot fluids, especially like coffee. So it's a hot acidic fluid that can leach some of that stuff out, and then you swallow it. Um, and
It's a funny
then
story, actually. You were talking about not microwaving in plastic. I used to do this all the time.
I
And then
remember
Ash
this.
scared me when we were in Alaska. I was like, oh,
Yeah.
you must want man boobs. That's cool. Go for it.
Yep, that's right.
And that ended it. I never microwaved in plastic again
Nice.
after that. That's all it
Hey,
took.
man, that's right. Sometimes fear works. That's great. Some of the highest containing BPA is going to be your fish products, like I said, as well as canned fruits and canned vegetables. We also see this in breast milk as well, just because BPA is kind of ubiquitous in our environment now. So they found it on the tops of mountains. They've even found it in the cord blood of newborn babies from hunter-gatherer tribes, like in Africa and other places, like people who are not exposed to these things on a regular basis. It's just it's everywhere in our environment. Um, and so these can reduce synthesis of LH, which again is that signal from your brain to your testicles to make testosterone. And so obviously it's going to affect your testosterone levels. DEHP. This is one of those things that makes plastics more flexible. So you're going to see these in toys. Shower curtains are a big one. Vinyl upholstery, adhesives, coatings. These can be in the sort of saran wrap type thing that's over your food, your meat, and stuff like that you get at the grocery store. It can be in some drinking water as well. Yeah, so that's a big one. That's another one that's all throughout our environment, and again, it's going to downregulate your production of testosterone.
I do have a question for you.
Yeah.
For the BPA, would it make a difference if you got farmed fish versus not farmed fish?
Well, for the most part, you want to stay away from farm fish.
Well, I
Just
agree. I agree. But I was just curious.
yeah, yeah. They're fed all kinds of junk. I don't know. It's specific to BPA if they're going to have more BPA in them. Um, yeah, that's a great question. I don't know. I mean, ideally, you want to go with wild caught, and then a type of fish that don't spend a ton of time in the ocean. So this is why kind of salmon are great, because they spend a couple years and then they go back to the rivers. So their lifespan inside the ocean is not that significant versus fish that spend their whole life, like sharks, swordfish, things like that. They're going to have higher levels of those heavy metals and other plastics that are just kind of in our oceans now.
Mhm.
PFAS is another one. These are kind of these forever chemicals, which means that they take hundreds to thousands of years to break down in our environment. And this is the stuff you're going to see in like carpets, synthetic clothing, adhesives, those nonstick like cookware, firefighting foams and stuff like that. So this is one that we really have to kind of watch with firefighters, especially to try to get it out of their system. And this one has been actually shown to be very cytotoxic to the Leydig cells, which are the cells inside the testicles that make testosterone. It can directly damage those cells.
And most
And
people know this, but never, ever, ever use a metal utensil in a nonstick pan.
oh yeah, yeah, for sure. Yeah, you're just scraping that stuff up and then into your food.
Yeah.
Yeah, use cast iron or ceramic or something like that. And then let's see. Oh, also, these PFAS chemicals have been shown to delay puberty in boys and girls. So obviously, like we're seeing significant hormonal influence even in younger kids. All right, and then this is just kind of like those previous charts. You can see BPA, phthalates, the PFAS, PCBs, and again, it's don't get kind of caught up in the picture here. It's still the same kind of issue. They're damaging things from the brain all the way down to the testicle level. Um,
Mhm.
so bad stuff. And then radiation. This is one that I really want guys listen up. Okay, this is significant. So you've got two types of radiation: ionizing and non-ionizing. So your non-ionizing are going to be things like cell phones, cell phone towers, wireless devices, microwave ovens, radars, stuff like that. These are we think these are kind of less damaging than ionizing radiation, but it doesn't mean that they're not significant. So we can see here, keeping a cell phone within 20 inches of your genitals is associated with Leydig cell damage, which is the cells that produce testosterone. And thus we see a reduction in testosterone. And we start to see all these abnormalities in sperm as well, as far as like quality and motility and all those kind of things that we look at to see if sperm are healthy. We see those changes occur the closer that cell phone gets to your genitals. So,
Wow, that's crazy because so many people
yeah,
keep it in their pocket, in their front pocket.
yeah, especially front pocket, like man, just right next to it. Yeah, not a good thing. So if you don't get anything else out of this, just don't carry around your cell phone as less as possible. Um, yeah, I've still got to
Yeah.
figure out a good solution for that.
Yeah, and each of these things compound. So even if you can, work on a couple things, you're going to make a bigger difference than if you work on nothing. Don't listen and be like, "Oh my gosh, this is so much. I just won't do anything." It's like, no, there are things you can do and there are things you can't do. Like I can't control the air, but
Right.
I can control what I do with what I eat, what I put in my pocket, how I act. So,
Yeah, yeah, that's true. So that's the gist of it. Not to kind of dive into this too deep because I can imagine everyone's eyes kind of glossing over right now. But I just wanted to kind of give you an idea of like there are a lot of things in our environment that can really impact our health as men at a significant level. Especially if you're in those childbearing years of you're wanting to have kids, like this is huge. But also
mhm.
just learning how to age sort of gracefully, you're going to need to pay attention to these things as well.
Absolutely. And something you said earlier, I really want to latch on to. Know your local farmers. People don't realize that it costs just about the same to go get delicious local produce as it does to go to a grocery store and get crap. And
Yeah.
the farmer you're supporting. You can ask them about their growing practices or how they feed their animals. Like there's a place right down the road before the hurricane destroyed their farm. But before that, I would get a lot of beef from them because it was all grass fed, not just grass finished. They took good care of their animals, and it was just about the same price or less than going to the grocery store. So you're helping your body, you're helping your neighborhood, and you're putting good stuff in that's going to help with longevity. It's going to help with fertility. It's going to help with everything.
Yeah, absolutely, man. That's true. And then so it brings up a good point. Like, so if a lot of these chemicals are just sort of ubiquitous in our environment, like, is there really any way to kind of fully 100%, get rid of them or limit our access or connection to them? And the answer is no. Like, I mean, you still need to do your best to avoid them, and that's eating organic when you can, exercising, it's like, drinking clean water, breathing clean air, eating clean food. Like, those are kind of the basics there, right? But for the stuff that you can't avoid, then you just help your body get rid of that stuff as
Mm.
quickly as you can. And that's where staying hydrated. So you got to optimize all your routes of elimination, right? And so that's basically sweat, poop, and pee. Okay. So you need to be sweating like 3, 4 times a week. So whether that's exercise or saunas or whatever, you need to use your biggest detoxing organ, which is your skin. So
Mhm.
that, and then, peeing these things out, some of these are going to be processed through the kidneys. And so you want to be sure that you're well hydrated and you're urinating often. And your urine should be mostly clear through most of the day, except for like your first morning void. And then make sure you're having regular bowel movements. 1 to 2 a day is sort of ideal. I can't tell you how many patients I see and I ask them this question and they're like, "Yeah, I have a bowel movement every 2 or 3 days." I'm like, no, that's not enough.
Yeah.
if if you don't, have ways of eliminating, then some of these chemicals can get just recirculated back through your colon as they're trying to be eliminated. So if you just kept it simple and you just kind of work those three things, then that's really going to get a lot of this. You don't have to do any special detoxing programs or cleanses or things like that. Not that those are necessarily bad, but you're always detoxing. So don't think like you have to do some special program to actually detox these things. Your body's always doing this. You could just enhance those pathways by doing those simple things.
I like that. And in Chinese medicine, the skin and the lung are connected. And part of that reason for that is the elimination of toxins. Like there's different ways to eliminate toxins. And, with the lungs, you're breathing out, carbon dioxide, among other things. And, you're pushing out toxins through your skin. And it's also, they see it as connected with immunity. So absolutely sweating, getting it out are going to be good things to do, and really just controlling what you can control and not freaking out about the rest. Because it's really easy to like look around and like, well, I can't control the air. And if you're anything like me, I almost dropped a cuss word. I'm glad I didn't on this show. But you're just like, you know what? F it. Like I can't control my environment, so I'm gonna
Yeah.
go eat,
Yeah.
6 bags of Doritos, and I'm gonna like microwave it,
Yeah.
like do everything I want because I can't
Yeah.
control this one thing.
Right. Yeah. This idea that we're in control of anything is pretty funny. But yeah, you're right. You make a great point, man. You just got to do the best you can with it, and then be okay with that. You know,
Yep,
and
and what I tell
that's
my
the right thing.
patients is start with one thing. If you feel
Yeah.
overwhelmed with everything you heard, pick one thing that you heard on the show and start with that. Start with no cell phone near the genitals. Like just start with that one.
That's a great one. Yeah.
And then next you can do, okay, I'm not going to microwave in plastic because I remember that I could get man boobs.
Uh-huh.
I'm going to stop that. And you just kind of
That's
you
right.
cascade it until it becomes a habit. And once these things
Yeah.
become habits, then it's super easy because you don't think about it.
Absolutely, man. Well said, dude. Well said. So I'm curious, is there anything as far as Chinese medicine goes and acupuncture that helps us detox better?
A lot of it's just going to be controlling the things you can control in your environment. Environment's huge in Chinese medicine. So, if you have to spend about the same or slightly more, sometimes it can be slightly more to get something that's good quality, it's going to add longevity, it's going to make your life better. It's worth that small price. Oh, I spent an extra $20 on groceries this week. But and it's hard for us in our society because we look at instant gratification. I'm like, well, I don't feel any different. I ate these local vegetables and I still feel the same as I did 2 days ago. It's like, it doesn't work like that. This is a
Yeah.
long-term, long-time thing. And so controlling what you can control in your environment, clean water, clean food, clean air, it's all going to be helpful. There's some antioxidants you can use. You know, uh, there's a Japanese knotweed is big in a lot of Chinese medicine, which you get resveratrol out of. But again, it's according to how you process it. So if you just boil some knotweed, you're going to kill off all the resveratrol, and then you're not going to get anything. And by the way, resveratrol, when we were talking about oxidative stress and oxidants, it's a very powerful antioxidant. So it's going to help neutralize that. But you have to take it in the right way. So I would say resveratrol is great if you look at it where it's taken in the the right way that can actually help you. There are nitrogen capsules out there that supposedly are pretty good for that. So yeah, just look into that and then make sure it's something that will actually help you, because a lot of supplements, if they're not done right, or if it's a cheap quality supplement, of like I got my Centrum from the grocery store, I'm good. It's like, according to what they do, the type of vitamin it is and how it's packaged, you may be getting zero benefit from that other than yellow urine. Like that may be your only thing you're getting from your vitamins. So like Dr. May has a really good line of multivitamins that I've actually noticed energy improvement on, but he really worked hard into cultivating that in a way that can actually be absorbed in your body.
Yeah. Yeah. That was a tough one. But yeah. And so, it begs the question, if we're talking about sort of the root cause here of this oxidative stress, then we have to ask ourselves, do antioxidants, which are supposed to help with that, do they actually help with this kind of issue? And here's a study here. It's a small study. It's 100 men, ages 23 to 46. And what they had is half of those guys, they took an oral antioxidant supplement. And this included a bunch of antioxidants, L-arginine, vitamin E, vitamin C, CoQ10, glutathione, and so on. And they did it for 6 months. And what they found was that after 6 months, the treatment group that got the antioxidants had increased levels of FSH and LH, which are the two hormones that stimulate your testicles to make testosterone and sperm. And they saw an increased level of testosterone as well. So it does sort of answer the question, do antioxidants help? Yep, they absolutely do.
And you put significant increases. So I don't know if you know this, Dr. May, but my undergrad is in psychology with a focus on experimental and research. Yep. So when you hear significant, that's actually a big term in research. That doesn't just mean like, oh, it was a nice change. It's an actual monetary value of like, 95 times out of 100 times that the study is run, it's going to show significant results. So you can be pretty darn sure that it's accurate.
Yeah. Yeah. Good point, Mike. That's exactly where I pulled up next was, what does significant mean? Does that mean cool. a 10% increase or what? Well, here you go. I'm glad you went there, Mike. That was great. So here we go. FSH levels increased by 30%, LH by 40.5%, and a total testosterone by 40.3%. So I'd say that's pretty significant. And Mike, you'll appreciate this. Great. You appreciate this. The p values of these were 0.008 or 6.
Yeah.
And like anything around a 0.05 or below is supposed to be significant.
Yeah, that's the standard in the industry is 0.05. So we're talking, 10 times more significant than what's considered normal on some of these, which is on total testosterone for sure. And that's incredible. Incredible.
Yeah. Yeah. So it's like, just doing something as simple as taking, a multi-antioxidant formula can really go a long way here. And I've seen this in practice myself, working with guys in infertility, low testosterone, stuff like that. Just sometimes starting simple, changing their diet, adding some antioxidants in here, getting them to exercise and sweat more. That's all we do. And we can see really significant improvements from that.
For sure. And I love that you put up the statistics. I'm a total statistics nerd, and I won't bore. Yeah. I will not bore.
I appreciate it. I am too. Yeah, I am too. Totally.
I will not bore all of you listening, but if you don't quite know what all those numbers mean, just know that it means that the study was valid. Most likely that the study was actually telling the truth, because sometimes you'll see a study and it won't have a p-value, and you'll find out later it was absolute garbage. Whereas these studies were like, okay, this was a valid study showing an actual change. So that's kind of the takeaway is like valid study, actual change. It's not like a, say presidential poll or like anything else. Any of these other numbers that you don't quite trust.
Yeah. So correct me if I'm wrong, but the p-value has to do with the likelihood of chance causing that outcome, right? So the higher the p-value, the more likely chance came into play with that outcome. Is that correct?
Yeah. So you can have a significant study with a p-value of, or you think it's significant, but the p-value is 0.2. So you have a 20% chance that that was just by chance. That would happen no matter what you did. You could give them a sugar pill and it would be the exact same result. And 20% doesn't sound like a lot, but over a large population, when you're taking things that cost money, it's significant. Whereas for those values, there's only a 1% chance that it was by chance. That means that, if you run that study twice and it's significant both times, then all of a sudden your chances go to 1 in 1,000. And it's not going to be likely at all that it's by chance. It was a real change that you can actually see.
Right. And you said less than 5% is what's considered sort of standard.
Yep. Standard is less than 5%. So if you have a p-value 0.04, then you know that 4% of the time that could still be by chance, which is why we run multiple studies, is because then you can look at, we did 5 studies. We repeated this study in different ways. And look, it was significantly, changed each time. Then it compounds your chances. But when you're talking, p-value of 0.01 or less, then it's not going to be by chance 99 times out of 100. It's just going to be, these are real results.
Yep. Nice. Well, that's awesome, man. Well, do you have anything else to share before we wrap up?
I'm holding myself back from going into the statistics. I will say one more thing, though. When this is just an info for anyone listening. When you're looking at studies and you're looking to see if they're real or not, look at the number of participants. That's one of the best ways to increase your p-value, is to have more participants, because it decreases chance. And so if you see a study that's like, we surveyed 3 people and here were the changes, even if it's significant, it's probably garbage, or it could be garbage, because you don't have a big enough sample to actually know. So when y'all are looking this up on your own, and I hope you do, take charge of your own health. This is something that I want to hone in on in our podcast, is take charge of your health. Be your own advocate. But when you're looking into this stuff, when you're researching, look at the quality. Look at, okay, they had 100 participants. They had 1,000 participants. This is what they saw. That's going to give you a better idea than, we did a case study with 3 people.
Yeah. No, it's a great point, man. Because oftentimes too, media and other organizations, just because they're trying to push a certain agenda or certain information, they'll take studies that are just very, very poor studies, and they'll throw those out there as sort of validation, right? But then you look deeper and you see like, oh, that was a really terrible study, and it wasn't reproduced. It has terrible p-values and all these other indicators that it's not valid.
Yeah. Another thing I would say is, what I said earlier, take away what you can take away. It's like, there's little things you can do that are going to help. Take a good, multivitamin, antioxidant, try to breathe clean air the best you can. You can't always help that, control where you put your cell phone, control what you eat and drink out of. Like, these are all things you can do. They're super easy and they're low hanging fruit. So take the low hanging fruit that you can, and don't freak out about the rest until you get to that point.
Amen, man. That's a great place to stop.
Hey, thanks a lot. This was a great presentation, man.
Yeah. Thanks. It went over well. I actually didn't get through all my slides in the presentation because we stopped and talked a lot, with other providers. And anyway, it was great. This is definitely a big issue.
I thought you were like, it went over well with your audience of 1 here.
It
went over great with Mike.
It was a significant, outcome.
Sample of 1. It went great.
That's great.
Well, hey, this was good, man. Thanks a lot.
Yeah, absolutely. All right, guys. Until next week, take care of yourselves, and we'll see you again in the future.
Hey, see y'all soon.
Bye.